Have you ever noticed subtle yet concerning changes in an elderly loved one and wondered if they were more than just the natural effects of aging? Many of us assume that death in old age comes suddenly, without warning, but in reality, the body often sends signals months, sometimes even a year, before life reaches its final stage. Unfortunately, these signs are frequently overlooked because they appear minor at first. It is only in hindsight that families recognize the clues were there all along. But by then, it may be too late to prepare, too late to make those last precious moments count. So what should we be looking for? How can we tell if an elderly loved one is entering their final year of life? These questions are both difficult and deeply emotional, but they are essential. Recognizing the early warnings of decline allows us to provide better care, make necessary arrangements, and most importantly, ensure that our loved ones experience their final stage of life with dignity, comfort, and peace. Understanding these signs is not about fearing death, it's about being prepared for it. It's about knowing when to shift the focus from medical intervention to comfort, from prolonging life at all costs to ensuring quality of life in the time that remains. As difficult as it may be to face, acknowledging these signs can help us cherish the moments we still have and make decisions that truly prioritize our loved ones' well-being. In this article, we will discuss 5 critical signs that an elderly person may be in their final year of life. From significant weight loss to changes in breathing and circulation, these indicators reveal how the body gradually prepares for its final transition. By paying attention to these signals and understanding their implications, we can better support our aging loved ones, ensuring that their final months are filled with love, comfort, and meaningful connection. Let's take a closer look at these 5 signs and what they mean for both the elderly individual and their family. Significant weight loss, unintentional weight loss, is often one of the earliest indicators that an elderly individual may be in their final year of life. At first, the changes may seem minor: a belt that suddenly needs tightening, clothes that appear looser, or a once hearty appetite that fades. Many families dismiss it as a normal part of aging, but in reality, losing weight without trying is rarely a good sign. It frequently signals that the body is no longer absorbing nutrients efficiently, muscle mass is decreasing, and essential systems are slowing down. Aging naturally leads to some muscle loss, but when it happens rapidly, it often indicates a deeper issue. The digestive system may struggle to process food properly, or the body may no longer be able to metabolize protein effectively, leading to muscle wasting. This decline in muscle mass does not only affect appearance, it weakens the body, increasing the risk of falls, making movement more difficult, and leaving the immune system compromised and more vulnerable to infections. Additionally, changes in appetite play a crucial role. Many elderly individuals in their final stage of life experience a reduced desire to eat. Their sense of taste may fade, food may no longer seem enjoyable, and they might start skipping meals or eating much smaller portions. This is not just a matter of preference, it is a physiological shift. As the body begins to shut down, it stops sending hunger signals to the brain as often, leading to lower energy levels, decreased strength, and an overall decline in health. Underlying medical conditions can further contribute to weight loss. Chronic diseases such as cancer, heart failure, or kidney disease often cause weight loss long before other symptoms become evident. Even mental health conditions, such as depression or cognitive decline, can reduce a person's desire to eat, creating a downward spiral where the body is not receiving enough fuel to sustain itself. Families often try to encourage their loved ones to eat more by offering favorite foods or supplementing meals with protein drinks. But if weight continues to drop despite these efforts, it is important to recognize that the issue is not simply dietary. The body may be preparing for a deeper transition. Instead of forcing large meals, which may be counterproductive, focusing on comfort, easy-to-eat foods, and hydration can make a significant difference in maintaining quality of life. Recognizing significant weight loss as a sign of the body's decline allows families to prepare emotionally and practically for what lies ahead. Extreme fatigue and weakness, A deep and persistent exhaustion that does not improve with rest is another common sign that an elderly individual may be in their final year. This is not just normal tiredness, it is a profound level of fatigue that makes even simple tasks feel overwhelming. Getting out of bed becomes a challenge, walking across the room requires effort, and everyday activities such as cooking, dressing, or even holding a conversation feel too draining. This extreme fatigue is not just a result of aging, it is the body's way of conserving its remaining energy. As organ function slows, the body prioritizes essential systems. The heart does not pump as efficiently, circulation weakens, and muscles do not receive the same level of oxygen they once did. This results in weakness, unsteadiness, and an inability to sustain previous levels of activity. Another contributing factor is metabolic slowdown. The body is designed to produce and use energy, but as it prepares for its final phase, that energy is redirected toward preservation rather than movement. This explains why individuals in decline may start sleeping more, requiring longer naps during the day, and finding it increasingly difficult to stay awake for long periods. Some may even experience sudden energy crashes where they seem fine one moment but completely drained the next. The emotional toll of fatigue can be significant. Many seniors who once took pride in their independence may feel frustrated or even embarrassed that they can no longer do what they used to. They may withdraw from conversations, avoid social interactions, or stop engaging in hobbies, not because they do not care, but because they simply do not have the energy. This can lead to a cycle of isolation where they stop trying altogether, accelerating their decline even further. For families, watching a loved one go from active and engaged to exhausted and withdrawn can be painful. It is easy to assume they just need to push through it, but forcing activity will not help. What matters most is understanding their limits, allowing them to rest when needed, and making their remaining days as comfortable as possible. Recognizing extreme fatigue as a sign of a major transition allows families to shift their focus from encouraging activity to creating moments of peace and support. Cognitive decline or social withdrawal. Another profound change that often appears in the final stage of life is a noticeable shift in cognitive function and social engagement. A person who was once sharp and engaged may start to forget things more often, struggle to follow conversations, or seem disoriented even in familiar places. They may repeat themselves, forget names, or lose track of time, even if they never had memory issues before. These cognitive changes can develop months or even a full year before death. This is not just everyday forgetfulness. Like any other organ, the brain requires a steady flow of oxygen and nutrients to function properly. As circulation weakens and oxygen supply to the brain decreases, cognitive function begins to decline. The person may become easily confused, have difficulty making decisions, or struggle to recognize people and places they have known for years. Some may even have brief moments of lucidity followed by sudden episodes of confusion, as if their mind is fading in and out. Emotional withdrawal is another common sign. Someone nearing the end of life often loses interest in social interactions. They may speak less, engage less, or spend long periods simply sitting in silence. It is not that they do not care about their loved ones, rather their brain is no longer processing emotions and engagement the same way. Conversations become tiring, loud environments feel overwhelming, and eventually many seniors retreat into their own world. Families may also notice mood and behavioral changes. Some individuals become more irritable, anxious, or easily frustrated, while others seem unusually calm, detached, or indifferent to things that once mattered to them. This is not just a personality shift, it is often the brain adjusting to the body's decline. As cognitive function slows, emotions become harder to express, and reactions to situations may change drastically. For family members, this stage can be especially difficult. Watching a loved one lose touch with reality or withdraw emotionally can feel like losing them before they are actually gone. However, it is important to remember that this is not something they can control. Instead of trying to bring them back into conversations, the best thing to do is meet them where they are. Speaking gently, offering reassurance, and understanding that even if they do not always respond, they can still feel presence and love. Recognizing cognitive decline and social withdrawal as indicators of the final transition allows families to adjust their expectations and focus on creating an environment that feels safe, familiar, and peaceful. Even when words fade, love and comfort can still be felt. Frequent infections and slow healing wounds. As individuals age, their immune system naturally weakens, making them more vulnerable to infections. In elderly individuals who are nearing the end of life, this decline in immune function becomes even more pronounced. The body struggles to fight off common infections, and illnesses that were once mild can become severe or even life-threatening. Pneumonia, urinary tract infections, UTIs, and skin infections are among the most common health concerns in this stage. Pneumonia, often referred to as the old man's friend in medical history, is a significant cause of mortality among the elderly. It can develop due to weakened lung function, difficulty clearing secretions, and overall frailty. Symptoms may include persistent coughing, difficulty breathing, confusion, or an overall decline in energy levels. UTIs are also more common due to decreased kidney function, incomplete bladder emptying, and a weakened immune system. Unlike in younger individuals, UTIs in the elderly can present with confusion, agitation, or sudden changes in behavior rather than the typical burning sensation during urination. Skin infections, including cellulitis and pressure ulcers, may also arise due to prolonged immobility and poor circulation. Another critical concern is the slow healing of wounds. In elderly individuals, even minor cuts, bruises, or pressure sores can take an unusually long time to heal. This is because the body's ability to repair tissues diminishes as circulation weakens and cell regeneration slows. Poor blood flow, particularly in individuals with conditions such as diabetes or vascular disease, further exacerbates this issue. Open wounds may become sites of infection, leading to further complications. Caregivers and family members should monitor for signs of infection such as fever, redness, swelling, and unusual discharge from wounds. In some cases, recurrent infections may require hospitalization, but in palliative care, the focus may shift to comfort and symptom management rather than aggressive treatment. Changes in breathing and circulation. As the body nears the end of life, it begins to conserve energy, leading to noticeable changes in breathing and circulation. These changes are often distressing for loved ones, but are a natural part of the dying process. One of the most prominent respiratory changes is the alteration in breathing patterns. The person may experience periods of shallow, irregular, or labored breathing. Some individuals may develop Cheyne-Stokes respiration, a distinctive breathing pattern where rapid breaths are followed by periods of no breathing, apnea. This can be alarming to witness, but it is a common occurrence as the brain's respiratory centers become less responsive to carbon dioxide levels. Shortness of breath, dyspnea, is another frequent symptom, even when the person is at rest. This can result in feelings of air hunger, where the individual struggles to take in enough oxygen. In such cases, palliative interventions such as oxygen therapy, opioid medications, or simple repositioning of the patient can provide relief. Circulatory changes also become apparent as the heart weakens and blood flow decreases. The body prioritizes vital organs like the heart and brain, reducing circulation to the extremities. As a result, the hands and feet may feel cold to the touch, appear pale, or take on a bluish or purplish hue, mottling. Blood pressure typically drops, leading to dizziness, confusion, or fainting episodes. Some individuals may also develop swelling in the feet and legs due to fluid retention caused by poor circulation. Caregivers should be aware that these signs do not necessarily indicate immediate death, but are strong indicators that the body is entering its final phase. Comfort measures, such as keeping the person warm, ensuring they are positioned comfortably, and using medication to ease discomfort, can help manage these symptoms and improve the quality of life in their final days. Recognizing these physiological changes can help families and caregivers prepare for what is to come and focus on providing compassionate end-of-life care. As we reach the end of this discussion, it is important to take a step back and reflect on the insights shared. The journey toward the final stage of life is a deeply personal and often challenging experience, not only for the elderly individual, but also for their loved ones. Recognizing the 5 key signs: significant weight loss, extreme fatigue, cognitive decline, frequent infections, and major changes in breathing and circulation can help us better understand what is happening and how we can respond with compassion and care. These signs do not necessarily mean that death is imminent, but they do indicate that the body is undergoing a natural process of slowing down. Instead of seeing these changes as something to fight against, we should embrace them as an opportunity to shift our focus from medical intervention to comfort, from prolonging life to making the most of the time that remains. The question then becomes, what can we do? How can we ensure that our loved ones' final months are spent in peace rather than distress? The answer lies in acceptance, presence, and thoughtful care. Small but meaningful actions such as ensuring they are comfortable, engaging in gentle conversations, creating a calm and familiar environment, and respecting their physical and emotional limits can make a profound difference in their quality of life. Furthermore, it is essential for families to prepare not only emotionally but also practically. Having open and honest conversations about end-of-life care, medical preferences, and personal wishes can alleviate stress and uncertainty when the time comes. Seeking guidance from healthcare professionals, hospice care teams, and support groups can also provide invaluable assistance in navigating this delicate stage of life. Ultimately, understanding these signs is not about fearing death. It is about embracing the final phase of life with love, dignity, and peace. It is about making sure that our loved ones are not alone, that they feel valued, and that their final moments are filled with warmth and connection. If you are noticing these changes in someone close to you, take a deep breath and remember, you are not alone. Many families have walked this path before, and while it is never easy, being informed and prepared can help you find the strength and patience to provide the care and support your loved one needs. Cherish every moment, hold their hand a little longer, and let them know they are loved. Because in the end, what matters most is not how long they live, but how deeply they are cared for in their final day. Thank you for joining us today. We hope you learned something valuable. Please share a key takeaway and how you'll apply it in practice. Your feedback helps us create more relevant content. If you found this video useful, please support us by liking, subscribing, and sharing. We look forward to seeing you in the next video.